This podcast will demonstrate and explain how to perform a connective tissue stretch for the quadriceps and the gastrocnemius muscle groups. Connective tissue stretch increases range of motion through first the application of heat to relax the collagen fibers, then applying a stretch to lengthen the collagen fibers, and finally applying cold, which forces the collagen fibers to reattach in a lengthened position.
Begin by selecting an appropriately sized hot pack and placing it in a hot pack sleeve. Because the patient will be lying on the hot pack, make sure an ample amount of padding is used to avoid burning the patient. Place the padded hot pack under the involved muscle group, in this instance the quadricep. The patient should be lying prone on a table with their head towards an open end. Heat the area for 15 minutes. While continuing to monitor the patient, start assembling the device you'll use to apply a stretch. Begin by using a small amount of weight, such as 5 pounds, and increase up to 15 pounds, or until an adequate stretch is applied. Secure the weight to a rope or a band.
After the 15-minute heating period, select an object that is high enough to be level with the foot when it's at a 90-degree angle. A stool works very well for this position. Place the stool upside down next to the patient's head and have them hold on to it. Once the stool is in position, flex the knee to 90 degrees and wrap one end of the rope around the foot. Make sure it is secure so that it does not slide off during the treatment. Pull the weighted end of the rope over the stool so it is hanging freely against gravity. Assure that an adequate stretch is being applied. The stretch should never be painful, which usually occurs when the resistance is too great. The patient will remain in this position for 15 minutes, during which you can assemble your ice bag. Manual resistance applied by the clinician cannot be used because of the amount of time required for the stretch to be applied.
Connective tissue stretch can be used on patients with reduced joint range of motion or flexibility due to immobilization. This should be used once the patient has regained 90% of their original range of motion. Some contraindications for connective tissue stretch include any exercise or activity that causes pain and use of ice on a person who is hypersensitive to cold.
After the 15-minute stretching and heating period, remove the hot pack and replace it with an ice bag while maintaining the stretch. The patient will remain in this position for a final 15 minutes. Once this phase is completed, the treatment is over. The connective tissue stretch treatment can be repeated on a daily basis and should be discontinued once the patient can progress to light resistance training.
Now this is a demonstration of the same technique being applied to the gastrocnemius. Again, it is not advisable to have a patient sit or lie on a hot pack due to risk of burns, but so long as they have sufficient padding and are closely monitored, it is acceptable for this method of treatment. The patient should first be screened for any contraindications, and then informed that the involved area will first be heated, but it should not be painful. Then the area will be stretched, which should also not be painful. And finally, the area will be iced, which should be uncomfortable until numb. Connective tissue stretch can be applied to any joint or muscle group in the body, so long as you have the appropriate equipment and the ability to position the patient in a manner in which the weight is pulled by gravity.
The entire treatment time for connective tissue stretch is 45 minutes, consisting of 3 phases that are 15 minutes each. The first phase is strictly heating of the involved area. The second phase is heating while applying a stretch, and the third phase is icing while maintaining the same stretch.